digital space is evolving. We are now seeing more and more improvements with movement from using analog x-rays where we had to have films, then we had to take the x-ray, have someone read it, interpret it, and then decide whether there is TB or not, to the use of artificial intelligence algorithms that are able to actually read, and from the WHO recommendations, actually, for persons aged above 15 years, they can be used in place of human readers. And it has made the TB screening and diagnosis process very fast, more accurate, and also taking care of the fact that in a lot of our developing nations, we do not have adequate numbers of radiologists. So the people who are able to read some of these x-rays are limited in number. And patients would need to move from one facility to the other to have the x-ray read. But now with technology, with AI, then whenever the x-ray is taken, even in the absence of a human reader, specifically for TB, we are able to have that provide very good interpretation. And then the other evolution with the AI is that within one single digital x-ray, we're able to do much more than TB. So if there was even any other pathology that was missed, that ordinarily maybe would not have been picked, with AI solutions now they're able to pick additional conditions. Once the x-ray is done, the clinician is actually able to access the results immediately through their phone, because what we have done is the AI solution we've deployed has cloud syncing capabilities and can also be connected through the local area network within the facility, meaning that the results can actually be accessed across departments, which means the results are available instantly, and the results are such that it can tell us if there is probable TB or not TB, and the clinician can be able to make a decision as to whether to proceed even with the molecular testing or not. We occasionally have a few instances where maybe this was missed because probably the patient is yet to have any radiological changes within the chest, or probably they could be having TB that is outside that particular chest, and therefore meaning that then the use of the history, the physical exam, and other adjunct tests as are needed based on what the patient is presenting with. The second reason why I wouldn't say it's better or worse is because, as I mentioned, the digital x-ray is good in telling us about the presence or the absence or likelihood of there being TB, but it's not able to tell us whether this particular TB is drug sensitive or drug resistant, which is very important because the treatment that is going to be given to that patient will primarily depend on our ability to tell that. Now, in most instances where we are not able to differentiate, and going back before we had molecular testing, we had microscopy. So we would all assume all the cases we're diagnosing are drug sensitive, and then if they don't improve, then we do culture and sensitivity to find out if they have any form of drug-resistant TB. But now we are saying we don't have to wait for a culture that may take weeks for the bacteria to grow in the lab. We're able to do that more rapidly in the field. As a national program, it is one of our core agenda and core priorities that we're envisioning to do. However, in the spirit of collaboration, we have various partners that are coming in to be able to support us in this endeavor. Now, one of the greatest partners that we have seen support us through that is the Global Fund, for example. They have been able to support the deployment of artificial intelligence software in up to 70 health facilities within the country already, meaning that these were digital x-rays that were already existing in the facility. They were in use, but they didn't have the AI technology. So through their support, then we've been able to deploy AI technology and improve the ability to diagnose TB within those facilities. Now, we also have other partners such as the US government support that have been able to provide both ultra-portable digital equipment with artificial intelligence that have been deployed to lower-level health facilities to help in screening and diagnosing of TB. Now, these equipment are used both within the facility and during community outreaches. And Kenya does not manufacture digital x-rays. neither have we gotten to a point where we can say we have an AI solution that was developed in Kenya. These are globally available products that we are able to procure through in-country resources, either from the government or from donor support, to be able to complement the process of TB diagnosis, management, and control. We began the process of mapping out the deployments early last year, in the beginning of 2024. And that meant that we assessed the health facilities, we were able to look at the existing infrastructure, we had to look at availability of staff, we had to look at the ability to be able to have people who can use the AI software when it's there. We looked at internet connectivity, we trained the healthcare workers, and then we deployed the AI beginning of May 2024. We began the process of mapping out the deployments early last year, in the beginning of 2024. And that meant that we assessed the health facilities, we were able to look at the existing infrastructure, we had to look at availability of staff, we had to look at the ability to be able to have people who can use the AI software when it's there. We looked at internet connectivity, we trained the healthcare workers, and then we deployed the AI beginning of May 2024. By the time we were coming to December, we had already done that in 69 health facilities. And by then we had done over 128,000 X-rays that were scanned using the AI software. Now, when I talk about 128, not all of them were chest X-rays, and that's the ride I would want to give. Now, these were scans that were done for all other conditions, and the AI solution that was deployed in the facilities was actually able to pick not just TB, but other lung or thoracic abnormalities. It was able to pick cardiomegaly, it was able to pick chronic lung diseases, it was able to pick lung nodules, which could be a precursor for lung cancer, which is very useful for us. It was able to pick fractures within the chest. So it was actually able to go above and beyond the screening for TB. Now, when we look at the scans that were done, out of all those, up to 35,000 were digital X-rays, of which up to about 4,000 actually were the ones that were identified to have probable TB. We do not have targets per se for digital X-rays, but we have target for case finding as a country. Now, when we look at the estimated incidence of TB in Kenya, we have an estimated incidence of about 124,000 patients who at any one time are presumed to have TB, as at the 2024 WHO Global Report. But we were only able to identify 97,000 out of those who are estimated to be there, meaning that over 20% of the estimated incidents are cases that are yet to be identified. So what we are hoping is the introduction of novel diagnostic technologies is aimed at helping us to accelerate that last mile to be able to find the missed cases of TB and get closer to TB elimination. One of the things we aim to do is to achieve the end TB targets within the expected time frame. The World Health Organization specifically has been pivotal in the process, both of developing the strategy of resource mobilization and during the deployment process, and now even as we are scaling it up. I'll say it depends on the level at which they're accessing care and services. So the way the health system in Kenya is currently structured, we have primary healthcare facilities. Those are the lower level facilities where diagnosis and treatment is free for all Kenyans. And therefore, if we deploy a digital X-ray there, we will not charge patients for that X-ray, which means it's actually accessible for all Kenyans who are accessing services at that level. If we go for community outreaches, we don't charge. So the higher level facilities, where I say it's still a cost saving for patients, is if patients were meant to pay for that X-ray, the fact that we are subjecting the X-ray to AI, we don't charge any extra money to that patient. We go ahead and screen that X-ray using AI at the original cost that this patient paid. And secondly, we are encouraging all persons to be able to access social health insurance so that then they can receive the cover to be able to access some of these diagnostic tests in the referral hospitals. We have patients who show up in health facilities for various reasons and end up having an X-ray done. And when this X-ray is done, because as I mentioned, we do not have adequate numbers of radiologists. If, for example, they were doing the X-ray because they think this patient has a cardiac problem, they will look at the cardiac systems and they will not look, probably they may look, but may miss other presenting symptoms in that patient. And we decided to deploy AI technology in these health facilities and ensure that when these patients get an X-ray, irrespective of why that chest X-ray was being done, it will be scanned for TB. And with that is how we've managed to increase our case detection by 51%.